All right, did you buy the school supplies? Are you ready for the return to school? Are you still saying, oh boy, is this the right decision to send kids back to school? If you're on the fence, if you can't make the decision, I know you don't really have a choice, but maybe you're thinking about the opt-out and getting the medical exemptions or doing the homeschooling. Let's go to an infectious disease expert to ask him what he thinks about it. And on top of it all, it's one of our favorites on the program. Dr. Don Vinh, infectious disease specialist and medical microbiologist at the MUHC, also doing work at the Research Institute of the MUHC. Dr. Vinh, thank you so much for coming back on the program. How you doing?
Good morning, Elias. How are you?
I'm okay. I think, listen, I put it up there right off the top. I think for a lot of parents, they don't know. They don't want to make these difficult decisions. They just want the expert to say, tell me what to do. So I'm going to ask you, Dr. Vinh, as you look at the upcoming school year, you know, and I don't want to delve too much in your private personal life, but if you've got school-age children, what decision would you make going back to school?
So I do have to say that I actually do. I have 4 school-age children.
Okay, I love this.
So I'm actually seeing this as both as an infectious disease specialist and as a parent. I do have to say that the most recent version of the government plan, it's a good start. It provides an infrastructure that I think will be helpful to guide schools and to guide parents. But it's a plan, right? And the success of any plan is you have to have established landmarks of either success or failure. You have to have contingency plans already in place, and you have to reassess your trajectory to make sure your plan is working or not. And I think what I'm hearing from colleagues, from parents, what you can see on social media, is that there's a lot of frustration by parents, by students, by teachers, because they don't feel that there's enough granularity in the plans that have been emitted. Mm-hmm. And I think that needs to be addressed.
You know, Dr. Vinh, when we were talking at the beginning of this whole crisis, the beginning of the pandemic, you know, we talked a lot about, you know, getting to the low risk, right? You know, because zero risk just doesn't exist. As you see it right now, the plan that is in place, who should be worried? Is it the kids? Is it the grandparents of those kids? Is it the teacher? What do you see is that point where, oh boy, this isn't low risk here. This is now moderate risk. This is now high risk.
Elias, I think you're touching on the exact point that I think is the undertone for a lot of the people's concerns out there in the public. What the government has put out is a standardized plan. This is the plan that all schools will follow. But you can't necessarily have a standardized plan for all schools, right? Mm-hmm. Because exactly like you said, these schools vary. They vary in terms of the number of students, the types of students, the health of the students. Same thing with the teachers. They vary in terms of classroom space, size, ventilation. They vary in terms of resources, and that's exactly. They need to have a standardized plan that provides a basic infrastructure. They've done that. They provide a basic guidance. But now I think the individual schools need to make sure that they have the support from government that they can administer the plan and tailor it to their school clientele.
We're with Dr. Don Vinh from the MUHC, infectious disease specialist. Dr. Vinh, what is the latest, our best medical knowledge when it comes to children getting COVID-19, how they spread the virus? Are they more likely to spread? Are they less likely? What do we know when it comes to children and how it affects them? And what's our best knowledge right now?
So those are excellent questions, and unfortunately they're not very simple, right? How often children are affected by COVID depends really on how often they get tested and the appropriate test, which is, as we all know, the stick in the nose, right? So the stick in the nose approach, the swab in the nose, that doesn't go well with kids in general. So sometimes those tests are omitted, and you just say, okay, you have a viral infection or you have whatever. And that's why sometimes the data in the children is a bit weak or incomplete. We do know on the latest data that children, according to the governmental age of 0 to 19, are about 8.5% of all positive tests so far. So it's not that children don't get infected. That's false. Children do get infected. They don't likely get severe disease, but they can. And there's this weird Kawasaki-like syndrome that's being worked on by some groups in the world. And there's also this concern about well, even if children do get infected, they don't necessarily transmit as well as adults. And again, that's not entirely conclusive. Mm-hmm. There are some studies that suggest that maybe some children or children in certain in certain parts of the world may not be transmitting as well as, say, adults. But then there are also data in other parts of the world, like there was a camp in Georgia where the CDC published that the younger children less than 10 years of age, were still contributing to transmission of the virus in the campgrounds. Mm-hmm. So I think that the data is a bit on the fence. There are some that suggest that children don't transmit well. There are some that say children probably transmit just as well. And again, we need more data, but I think until we have the data, we really need to err on the side of caution.
If a parent came to you with their child and said, hey, we want a medical note to exempt us from going back to school, what would be your determining factors as to whether you would give that medical note?
The exemption from the on-site school education really has to be medically based. That the child or some member in the family, like a parent, or maybe some children live with their grandparents, some member in that household has to have a medical condition that either can worsen if they get COVID or that can put them at increased risk for getting severe COVID. But the socio-psychological reasons where I'm too anxious to send the person back to school or all these sort of things like that, mm-hmm. Those we really need to avoid, because what we don't want, how we talked about previously, Elias, about the surge capacity of the healthcare system, and we didn't want to overwhelm the ICUs.
Yeah.
Well, it's the same thing here, right? We don't want to overwhelm the medical system that's already trying to ramp back up and provide clinical care to the whole community by being bombarded by having to fill out forms that are really not appropriate.
I want to ask you, Dr. Vinh, you mentioned your 4 kids. What's the plan for your 4 kids this fall?
They're going back to school. I have to tell you, I'm going to be fully honest. One of my kids' schools, I've been actually working with them for the last few months to actually help develop and implement a plan of safe return. And
with regards to that and your kids going back, how much do you think there's a responsibility on the parents to prepare their kids to, when they get to the classroom, to be safe, not to maybe roughhouse as much as they used to? Like, how much responsibility should fall on parents and kids, you think, when it comes to the plan and keeping safe with COVID-19?
Great question, and I think the answer is the African proverb, right? It takes a village to raise a child. It's not up to the school teachers or the school faculty to do exclusively the work. Parents need to take responsibility, and that necessarily means screening their child for symptoms of COVID. That you can find anywhere on Google what those symptoms are. And if there's symptoms, don't say, I'm going to drop you off to school because I got to go to work anyways. No, you need to make sure that if your child has symptoms, you need to take responsibility for that. You can't send the child to school. You need to educate your child about what are safe practices and safe measures, and you need to try and reinforce it so that it's not a foreign concept to them when they come to school.
And I want to talk maybe on a different tangent. One last note here. Heard some reports about a new saliva test for COVID-19. Can you tell us about this saliva test and why it is such an important development?
So this saliva test is being tested. It was developed by a few. There are different groups in the world that have developed their own versions of it, and it's being tested in different countries in the world. What it does is it's collection of saliva or a spit from the mouth, so that it can allow for the testing of the virus. And why that's perhaps if the test pans out and it is a good test, it may be helpful because it may facilitate testing. So instead of having to do the stick in the nose, which is not a very fast process, you can actually be able to collect saliva a lot faster, and that means you can test a lot of people at the same time or collect saliva from a lot of people all around the same time. And this may allow more effective screening and allow quicker implementation of public health measures. And
correct me if I'm wrong, cost is a big thing here. These saliva tests are cheaper than jabbing a Q-tip up someone's nose?
All these tests are variable. There are different tests that have different costs. The test that we currently use, which is the stick in the nose, is not particularly expensive either. It's just that the reagents, may be in global demand. However, the saliva test, some of the saliva tests, even though they're just collecting saliva instead of a stick in the nose, every other step after that is about the same.
Dr. Don Vinh, infectious disease specialist, thanks for coming back on the show. You were such a terrific resource for us during the beginning of the pandemic. It's always great to catch up with you, Dr. Vinh. Thanks so much.
Thank you very much, Elias. I appreciate it.
All right, that's Don Vinh from the MUHC.